That is the first paper to ever show that in the literature, but it makes perfect sense. So let's take it a step further and explore like what has been shown recently. And there was a paper published in July 2025 in a prominent plastic surgery journal about, they call it the transcriptome. And so the title of the paper is Transcriptome of Capsular Contracture Around Breast Implants Mimics Allograft Rejection, a matched case control study. So that's a very, that's a mouthful of a title, but let's think of it, simply. If an implant is placed, the traditional thinking was it forms a foreign body reaction. Think of like getting a splinter caught in your finger. You may get a bump around it. So that's more of a foreign body reaction. On examination, looking at pathology, it'll show signs of chronic inflammation. So when the pathologist looks at it under the microscope, they'll see cells like giant cells and histiocytes, and those are the traditional cells that form when you're looking at a foreign body reaction. But in this paper, in patients they were looking at with, we'll say, thicker, firmer, or maybe more tender scar capsules, and using the Baker classification from the 1970s, that is incredibly subjective, but nonetheless, that's what we have in this study to evaluate and other studies. They found that the scar tissue is creating more of a organ rejection picture. And so instead of a foreign body reaction where you have histiocytes and giant cells being formed, they're actually seeing more of a T cell, a B cell, and what's called a plasma cell response, actual antibody production in this setting. So that is the first paper to ever show that in the literature, but it makes perfect sense. Now, obviously a breast implant is not going to be recognized as your own tissue because it can't. Also, it makes sense that any debris that is left inside of a pocket, especially if there's a rupture or any debris coming off the capsule, there would be a T cell receptor recognition of that would show it to the immune system, that would activate your immune response. So that all makes perfect sense. And I've been asked routinely, like, what do I think are safe implants?